Today we will be doing a central line dressing change. Okay, for our first step, hand hygiene. After that, we will use two patient verification forms to verify the patient relation. So, Mr. Spar, date of birth, 06/22/20.
Okay.
Excellent. Okay, so after this, we are going to put our patient in a semi-Fowler's position at a workable height. Okay. All right. At this point, we will be either turning our patient's head to the left or ensuring that they have their mask on. We also want to make sure that we have our mask on at a later time as well. So we're going to don clean, non-sterile gloves. And at this point, we will be assessing the central line.
And then you're also going to explain the procedure. So.
Oh, yes. So, Mr. Spar, today we will be doing our dressing change on your port that you have there. It should be non-painful and it should be non-invasive, okay? So if you have any questions for me, let me know. No? Okay, excellent. So at this time, we're going to just be assessing for temperature.
Okay.
No redness, swelling. Do you have any pain, sir? No? Excellent. Okay, so this is on top of our old sterile dressing. We took it off prior, but there's a dressing here.
Okay.
Okay, so at this time, we're going to use our alcohol swab to take off the old dressing.
Okay.
So if it was there, we would have taken it off, release that. If we had the disc as well, we would also remove the disc.
Okay.
Okay, so now we've done that, we're going to remove our gloves. Perform hand hygiene. Okay, so now we're going to prepare our sterile kits.
Okay.
Okay, so touching our 1-inch borders. Okay. We are going to drop our disc into the sterile area. Okay, awesome. Okay, at this time we can remove our gloves. We'll be removing our gloves.
Okay.
And if we had a mask in here, we would be removing our mask as well.
And putting it on.
And putting it on.
Okay.
Okay. So now we're going to remove our drapes.
Okay.
Okay. So using our 1-inch sterile border.
Yes.
Okay, so sunny side down. If you can slip it under. If you're a pro, but we're not pros here, so we're gonna just leave it like that.
Okay.
We're also gonna be dropping in a separate gauze for our preference.
To pick it up.
Yeah, pick it up. Or we don't have to drop it in there. We could just.
I think you. Yeah.
Right? Yeah.
Because you're still not sterile.
Yeah, we're not sterile yet. So we're going to use our gauze.
Okay.
To pick it up.
Pick it up. Put it over.
And put it over. Okay. So you can use this in case you don't get it all the way under, which is okay. 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 All right. So this gauze has been used. Okay. So now we're going to don our sterile gloves. Okay.
And you did it perfectly.
Perfectly. Because our preceptor is watching. Okay. Okay, so now we're sterile.
Okay, and now you're number 10. You just put 9 and now 10. Arranges sterile supplies as needed.
All right, so I'm gonna open up our swabs.
Okay.
Have them ready.
Okay.
Okay. So we're gonna have our sterile swabs ready. Okay. All right, so now we have everything ready.
Okay.
So we're gonna get our chlorhexidine swab and we're going to break it. Okay. All right, so it's good. So now we're going to grab one of our gauzes. Maintaining sterility. We're gonna use it to hold down our ports and in an up and down motion. we're going to clean. Okay, we're gonna let that dry.
Okay.
Okay, so now this is dirty, so I'll
Throw
leave
away?
it here though. But you throw it away.
Okay.
Okay, so now we get our second gauze.
Okay.
And now we're gonna just use our gauze to grab our ports.
Mhm.
And then we're just, make sure you, I just did that, but you don't want to do that. You don't want to put your hand because you're sterile.
Mhm.
And you're gonna just clean your ports.
Maintaining sterility. Everything
Maintaining
looks good.
sterility. Okay, put it down. So now
Okay.
this is dirty. Now we're gonna just let it dry, air dry.
Okay.
So after that, we are going to grab our disc that we have.
And you just allow it to dry. So I'm gonna just recap. So on 12, you scrub the catheter hub, extension tails, any sutures, and exposed catheter
Yes.
with sterile swab. You're gonna allow number 13, allow site to dry.
Yes.
Does not fan. And then in 14, we already did that earlier. Apply biopatch.
No, we're gonna put the
Oh, I'm sorry.
So now we're gonna put the bio patch. We're gonna put it blue side up.
Okay.
So I'm gonna grab our. At this time, we're not sterile anymore, right?
I don't remember, but just
Okay. Ta-da!
okay.
Okay. All right. So then after that, we're going to grab our
Okay.
patch.
Yes.
Okay.
And then remove the drape if one was used. So
Oh,
at this point, you remove it.
so after the blue disc, remove your drape. So I'm assuming we're not sterile anymore.
Yeah, because you touched it. So
Yeah.
So now we're in 16. Applies transparent dressing that comes in the kit. So you're applying the dressing. Okay, perfect.
Okay, so you're gonna put it over the entire site, and you don't want to leave it. I think that'll be good, right? Like right there. 'Cause you can still, like maneuver the ports, but
Yes.
it's not too up, it's not too down. Okay. So once we have a good line of sight,
Mhm.
remove this. Okay. I feel like this is weird though. Okay, well, there's a huge bubble, but okay. All right.
Okay.
And then
And
we're gonna
now
use
you're on 17.
date and time.
Yes, date and time. Loops the catheter as needed and secures it with tape on. So after she's done dating and timing, she will go to 17 and loop the catheter as needed and secure it with tape to the skin.
Okay.
Avoid.
I'll put it on
Go
the
ahead.
side. I'll put it like right there.
Yeah, perfect. Okay. And it says that avoid securing it to the dressing, or depending on type of CVC, place clear tape across the ends of the lumens.
Okay, so
Near but not on the hubs.
yeah, so
Perfect.
we put it right next to the dressing, but it's on the pads, so they can still manipulate it
Okay.
and all that good stuff.
Yeah, and then I guess 18 was labels, the dressing with the date, change time.
Oh, okay.
You're fine.
All right.
Disposes. Yeah, you're
This
good.
concludes our dressing change.
Okay.
And then we just get rid of all our stuff, and that's it.
Good.